Hey there, psychology students. Professor Zeeb here. Welcome to another audiovisual lecture. This time we're going to expand on mood disorders, which is the current chapter we've been learning about. We did learn that there are different types of mood disorders. So now what we're going to look at are some additional defining criteria for mood disorders. So in other words, these are what we call specifiers to kind of explain what else is going on with the person when they're diagnosed with a mood disorder. Okay, so specifiers are technically other symptoms that may accompany a mood disorder. Sometimes they occur, sometimes they do not occur. It's different from person to person, but they're important to note for the psychologist because it helps to direct treatment. In other words, it kind of dictates what treatment should be using, or in other words, it's guiding the therapist to use the most effective treatment based on what's presenting in the client. There are basically two types. So we have those that describe the most recent episode of depression. So in other words, what's has just happened with the client in terms of their depressive episode, and then some of them described the course or temporal pattern of the actual depressive episode or the course of the depression itself. So there's a checklist basically that the DSM gives for psychologists to look at and to note if these are present in the client, once again, to direct and help the direct treatment and to help it become more effective, excuse me. All right, so let's look at them. There's a little bit of a list here. And so we'll just kind of go through them one by one here. So these are our basic specifiers of depressive episodes. The first grouping is what we call atypical features. In other words, these are unexpected features that we would note in the client. So this applies to, depression, but also persistent depression, but not mania. So some of these, apply to many forms of depression or only certain ones. So in this case, it applies to major depression and persistent. And so here we're seeing symptoms that seem unusual or unexpected. So, for example, the person may oversleep, overeat, they may show anxiety or gain weight, for example. And so these are important because they're associated with different factors, including an earlier age of onset. Uh, they also are associated with a greater percentage of women. So we see this more in the female population. It's often associated with more severe symptoms, and a lot of times they often have another uh, disorder going on. So, in other words, another problem. It could be something like alcohol abuse as well. So, once again, these are important because it's also associated with the more likelihood for suicide. So, it's obviously a very important one to note. The second group are known as melancholic feature specifier. So these only apply if the full criteria for a major depressive episode has been met. This is going to include some more severe symptoms. So, for example, it could include loss of sex drive, excessive guilt, the person is waking up too early, for example, or the inability to experience pleasure, which we call anhedonia. So, in general, these particular symptoms signify a more severe type of depressive episode. So, obviously, we'd want to note that. Okay, the next one is called catatonic, catatonic feature specifier. Essentially, these are problems with movement. So, the person is showing some odd movement symptoms in addition to their depressive symptoms. This can apply to major depression as well as manic episodes. It's thought to be extremely rare, so it's very rare, especially in our manic cases. So it's thought to be more of a rare one. But here, the issue is that the person is moving in some kind of unexpected way. So it could be that they have total absence of movement, almost like they're a statue, or they'll hold positions if you move their arms, for example, almost like a mannequin kind of thing. which is known as cataplexy. Okay. So their arms and legs remain semi-rigid, basically, or it could also involve excessive movements that seem more random in nature. So the person could remain in these positions for long periods of time. So it's kind of a strange one. This is one we often see with schizophrenia, certain types of schizophrenia as well. However, in this case, we're saying they're showing depression, but they're also showing this symptom as well. Okay, the next group is psychotic features. These are also thought to be rare. So this applies where the psychotic symptoms are experienced during a major or manic episode. Typically, they show poor response to treatment and greater impairment. So some classic examples of these ones would be like hallucinations, where you're hearing or seeing something that's not there, or delusions, where you're believing something that is unfounded. So, for example, they may hear voices. Or another example of like a delusion is they think their body is rotting from the inside. So there's a whole different host of these. So obviously they're pretty serious in nature because they, involve the psychotic episode there. The symptom content directly relates to the depressed mood, but can also be what we call mood incongruent, where it's not necessarily tied to that. So it can or cannot be. Uh, so, for example, delusions of grandeur would be an interesting one to kind of look at with this, where it's not necessarily tied to the particular depressive episode, but this is where they think that they're supernatural or extremely gifted in some way where it's clearly unfounded. These ones are really serious because in some cases it could progress to schizophrenia. So these would need to be noted and then addressed in treatment, of course. Okay, switching gears completely, we go to peripartum onset specifier. This applies to major and manic episodes. So basically, they're showing symptoms in connection to surrounding a pregnancy. So typically, it's the end of pregnancy and then even 6 weeks after the child has been born. These can be very serious in nature because in some cases they can be psychotic in nature where the person may actually kill their child. So obviously we'd need to note those extremely quickly. So according to research, about 13 to 19% of women giving birth meet the criteria for major depressive episode, and the incidence is higher after birth rather than during pregnancy. So I want to make a point that this would be different than what we know as baby blues, where maybe for a couple days after the birth, the woman shows depression. In this case, it could be prolonged up to 6 months. And by the way, this affects men and women. It's not just mothers, it can be fathers as well, as noted in the research. All right, let's go to our next group, which is the anxious distress specifier. So this is the presence and severity of anxiety that accompanies depression. In this case, the person may or may not meet the criteria for an anxiety disorder. So in some cases, they've already met that diagnosis, but in some cases, they have not. This one's another important one because it's often associated with suicidal thoughts and actions and actually predicts poor outcome to treatment. So we'd want to note that and address that. Okay, mixed features specifier, pretty self-explanatory. There's at least 3 symptoms of mania present. It applies to major depression and persistent depression. So in other words, there's been at least 3 of those symptoms in the person. All right, and then we have the seasonal pattern. So in this case, the depression is surrounding a seasonal pattern. Okay, so this is also known as seasonal affective disorder, or SAD as the acronym. So it applies to recurrent major depression and bipolar, where it happens during certain seasons. For example, they may become very depressed during the winter months. So it's often tied to natural season, and then maybe spring and summer they show a manic phase. So the point is that the symptoms seem directly connected to the time of year or the season, if you would. And so this one has often been connected to increased melatonin, especially high, it increases during winter, and lack of sunlight. So one of the treatments for this one would be sitting in front of a bright light that seems to kind of reset their chemicals in their brain to help them. Research has also shown that this one's more prevalent in the higher latitudes where there's lack of sunlight. There's not as much sunlight as other parts on the globe, if you would. Okay? So once again, these are just different things that the psychologist would note when they diagnose someone with a mood disorder, because there may be other things going on. All right, so hopefully you enjoyed that and understood that. Remember, you can always email me if you have questions. Please progress to the next step in the class.